A lot of people have asked me, Gwen, how do I increase my white blood cells? I'm experiencing a lot of fatigue, a lot of tiredness. What causes a low white blood cell count? Hello everyone, I'm your favorite medical microbiologist, popularly known as the medical professional with the difference. Stay tuned for more. Hello everyone, today we'll be focusing on white blood cells, causes of low white blood cells, and also how to increase our white blood cells. The white blood cells are also known as leukocytes. The white blood cells are responsible for fighting diseases and infections in our bodies, and they are produced in the bone marrow. There are 5 types of white blood cells in our body. We have monocytes, lymphocytes, eosinophils, basophils, and neutrophils. Now, the normal level of white blood cells in our body is approximately 4,000 white blood cells per microliter of blood. We may have conditions in our bodies that actually increase our white blood cells, and we may also have conditions in our bodies that decrease our white blood cell. So for the sake of this video, we'll be focusing on low white blood cells. So what are the causes of low white blood cells? Number 1, genetics. The people who are naturally born with a low white blood count, no matter the test you would do, they still have low white blood count. We have HIV patients, tuberculosis, those with enlarged or damaged liver or spleen. We also have radiation therapy for cancer patients, chemotherapy for cancer. We also have bone marrow disorders, and also autoimmune diseases. Autoimmune diseases is when the immune system of an individual begins to fight himself. An example of an autoimmune disease is lupus. Now, how can we diagnose low white blood cells? Now, there are a couple of tests you're going to do when you go to your doctors. Going to run a complete blood count, a CBC, and it's going to be determine your level of white blood cells in your blood. That most often a bone marrow examination, a bone marrow biopsy is also being carried out to check if you have a disorder, if you have a bone marrow disorder, because your white blood cells are being produced in your bone marrow. So that is very important. So how can we prevent ourselves from having infections and diseases if we have low white blood cells? Point number 1, good hygiene. Wash your hands, live in a clean environment, be hygienic. Let your hygiene be real good. Live in a clean environment. Protect yourself, use mosquito nets. Don't just live anyhow. Don't just live an irresponsible life. Avoid drugs. And when I'm talking about drugs, I'm talking about heroin, cocaine, marijuana, and even coffee. Anything that could weaken your immune system, make your immune system a little bit weaker, avoid it. Avoid sharing needles. Have protected sex. Also avoid being around people who are ill. Don't stay for too long in the hospital, especially in environments where people are being quarantined for particular illnesses or infections. Also stay away from pets. Stay away from pets because they are an organism that will always lick here and lick there, lick here and lick here, and they'll come by you even if the pets are being vaccinated. We are just trying to reduce the amount of infections or diseases that you may get, and also eat clean food. Don't eat anywhere. Don't go out and eat from the roadside. Don't eat anywhere or anything. Be very cautious about your health. Very, very important. Now, another point is, very important point is, there is a drug I found on the market, and that is Grasfel. This is the drug. Grasfel is actually a human granulocyte colony stimulating factor analog. So it actually causes the bone marrow to produce white blood cells, and it's from the company Filgrastim, a Filgrastim injection. It's normally stored in the refrigerator, and when you take it out of the refrigerator, you then leave it out for like 30 minutes before you use it. And you could use this after your chemo. Like, your doctor would explain to you how to use this, but this is a drug that could increase your white blood cells if you're going through, if you're an HIV patient, if you have a damaged or liver or enlarged liver or spleen, if you're tuberculosis, if you have a bone marrow disorder, if you're going through a bone marrow transplant, if you are actually having a chemo, you know. And this is also for those who are genetically born with low white blood cells. My advice to anyone, especially if you're genetically born with low white blood cells, is never go through an operation without increasing your white blood cells, because you are more likely to have infections after the operation. That means your body won't fight away infections. So you need this. This is actually 300 mcg. It's very good. I bought this in India, and it's a good drug. This is for those who are going through cancer treatments and all that, also autoimmune diseases. You need this so that your body can able to fight the infections while you're going through treatment, you know, or just giving you a boost. So in case you have any questions, you could ask. And this is also used for people, I wrote down, those who are going through bone marrow procedures to prevent infections during operation, chemo, HIV patients, chronic neutropenia. So get this drug because we really need it. It's Grasfel. I'm going to write down the description of the drug in the description box so that you can look at it, you can buy it. Doctors, we need this. We need this. It's actually good. It's actually a colony stimulating factor. In case you have any questions, please do pop them down in the question area, and I'll be so ready to answer regarding this topic. So till next time, I'm your favorite medical professional, Gwendolyn Halley. Stay tuned.